Welcome, everybody. Our topic this morning is how to utilize ancillary wellness staff to create a successful integrative healthcare practice. And listening to Raquel speak, it sounds like we've done a pretty good job of doing the model that she's predicting. So I'm a physical therapist and have been in practice for over 25 years, and my better half, Linda, has been a physician assistant for about that length of time. And I could use some help with this. So we're based in Sedona, Arizona, the beautiful Red Rocks. Incredible place to practice and live. This is our core medical staff, and the whole definition of integrative has to do with both how we relate to each other and also how we relate to our staff. On the far left is our office manager, Dom, followed by Amanda, our front desk person, Linda, myself, Thomas, who's a clinical assistant, and Amanda, Tara rather, who's a back office clinical assistant as well.
So what really is an integrative practice? If you look at who are ancillary medical personnel, our whole office is ancillary medical personnel. Eric and I own the practice, but as you heard, I'm a PA, Eric's a PT. Can you go to the next one? Thank you. We really try to look at the patient as a whole and not look at just their disease or just what's going on with one condition. And that's part of prevention. I really do a lot of my practice in bioidentical hormone replacement therapy. But when they come in for that, you can't just look at the hormones. You've got to look at the entire patient. So that's a big part of getting into the entire thing. We do coordinated clinical services, try to get the patients treated so they don't fall through the cracks, and really give them the best access to both Western medicine and to different alternatives, depending on what's best for them.
So a little bit about practice dynamics and our story. We were both working at another medical clinic, integrative medical clinic in Sedona, Arizona. I'd been working there a number of years as a physical therapist, actually as an independent contractor. Linda was hired, and what I saw very quickly was, of all the medical staff, she was the one most receptive to breaking outside the box, breaking outside of her schedule, and being responsive should a patient of mine in physical therapy have a medical need. Hey, I just came in, I've got these hives all over my body, the doc gave me a new prescription, I can't get to see them for 2 weeks, what do I do? And I said, well, let me see if Linda's available, and most oftentimes she would be and could address that particular problem. Likewise, frequently in the course of a medical practice, just about everybody has some kind of orthopedic issue, and they'd see her for, say, a diabetes checkup. Oh, and by the way, I fell down the stairs yesterday and I have a sore ankle and leg. Do I need to get x-rays? And Linda would call me down. So this led to our working partnership, which obviously led to other things since we're now married. But this integration between providers and support staff is also crucial, as well as the integration between ourselves and the referral network that we use. Here's a picture of our front desk. Most of the artwork you see up there has been donated by patients, incredible artists in Sedona. We focus a big part of our practice on creating an ambiance that is healing in and of itself, with pictures of beautiful places and an aesthetic that leads people to say, wow, I feel better just coming into your office. I had a patient last week say, it feels like I'm moving into a temple. How very Sedona. Here's Thomas doing blood pressure, Doc doing, Dom, who's our office manager. So who are ancillary wellness staff?
Well, as I said, our office basically is all ancillary medical staff. Interestingly, onto this list you can add a physician. As a PA, I do have to have a supervising physician. Her office is about a block away from ours. But by and large, our practice is entirely ancillary medical staff. And you think of PAs and nurse practitioners, we do not make as much money as an MD or a DO. So hiring in a PA or a nurse practitioner onto your staff just makes financial sense. The nurses as well, medical assistants and clinical assistants. Medical assistants are licensed and certified. Clinical assistants are somebody that you chose off the street when you hired them, and you can train them to do whatever you choose. Our clinical assistants not only do vitals for us, but they take a very detailed medical history. They do weight loss management for me. They'll do injections, immunizations, whatever it calls for at the time.
So what other kinds of ancillary therapists and practitioners might be included?
Okay, sorry. I forgot that was my turn too. Well, physical therapists, of course. That's a big part of what we do there, but you have to look at our population. Our population are the baby boomers. And I do have some younger patients too, but the city of Sedona is primarily a retirement community other than those who are vacationing there. Occupational therapists as well. Clinical psychologists and counselors, that's a big part. We have a counselor right now. We've had a psychiatrist on in our practice at times too. Chiropractors can be utilized, massage therapists definitely. Personal trainers. We have a yoga instructor who is one of our staff members, but also teaches yoga for our patients. You can utilize acupuncturists. A nutritionist is very important. You really have to work with your diabetics. If you've got somebody who needs to be off gluten, and that's a big fad right now, but it's really a good thing for everybody. I'm not upset that it's a fad at all. But to try to get people to understand what has gluten in it, what do I need to avoid, you don't really have the time to sit down and explain that. You need to send them to somebody who could sit down and explain all of that and get them some handouts. Maybe have some days that they come in and taste test and share some recipes with each other. Laboratory services. We did talk about the Stark laws, and Eric will talk about that a little more. We actually have Sonora Quest who comes in and does our labs. But it's nice having the lab there. It really increases compliance. If I give a lab form to somebody and hope they're going to get it done, maybe they'll remember to do that and want to go do it, and maybe they won't. If they get it done right there in the office, it's a much nicer atmosphere. They get it done. I get the results right away. It falls right into my electronic medical records.
So just a few pictures. Here's me working on Linda for a clinical study on cervical manipulation. Obviously a blood draw, someone doing massage. So what are the possible business arrangements with ancillary staff? Of course they can be employees. I mentioned being an independent contractor as a physical therapist. This is an easy way to save money as a business owner, in which the independent contractor rents space and with a share of expenses and a profit margin built into you as the business owner to make it worth your while. Stark law was mentioned earlier. This is basically, this is basically a law that was written for physicians who are referring Medicare patients or Medicaid patients to what are called designated health services if the physician has a financial relationship with that entity, unless an exception applies. So if any of you have questions after the presentation, I can go through what that criteria is. But if they're employees of yours, it's not a problem. If they're independent contractors, if there's a written agreement such that your referral as a primary provider is not directly compensated by the entities that you're referring to.